This blood transfusion, whether it affects any investigations like bone marrow number 1, number 2, HbA1c or like that. Is clear?
Yes, okay. Actually speaking, blood transfusion affects, to be more frank, many times, suppose even a simple thalassemia for that matter, if the child before coming to us, if they get transfused, the donors many times they are normal people who are having more hemoglobin of more than 12, etc., who are not thalassemias. So this blood which is there again lives for say another 2 months, 3 months, etc. And this kind of grossly deviates our HPLC reports especially. And one more thing that blood transfusion plays a role is in B12 deficiency. In this part it is not so common, but still when you give blood it has a good amount of B12, and when you give B12 to a patient who is B12 deficient, within a single day the bone marrow reverts back to normal. So I will do a bone marrow after 2 days, I may find I may be confused that what I am looking into. I may report it as something else. So that problem is definitely there, unless always the patient is in a failure. It's better to avoid transfusion before any investigations. That will otherwise confuse the picture.
One question please.
Yeah.
Actually I was in charge of a school where 20,000 tribal students were there.
Okay.
Amongst them, almost 5% are having a sickle cell disease.
Okay.
Another 7 to 8% are having trait, sickle cell trait.
Yes.
And almost all the students, about 80% they are anemic. Their hemoglobin is not more than 10.
Okay.
It varies from 8 to 11 like this.
Okay.
What precautions they should take in case of sickle cell anemia so that they shouldn't have crisis?
Okay.
All are tribal students.
Yes, yes, yes. Actually, sir, many times sickle cell disease for that matter, the phenotype varies according to many secondary genetic factors, but in general, a proper hydration, because as it was shown there, dehydration and other things, the clogging of these cells, there is deoxygenation is the main factor for many of your sickle cell related crises. In trials, it is very rare patient go into crisis many times, because minimum 60% that HbS is needed to cause any crisis situation. But a proper hydration, if possible, your hydroxyurea, which increases your HbF if the patient is prone for developing any crisis situations. These are the only two options. Otherwise, we don't in India relatively the crisis situations are a bit lower compared to others. And many times these patients they are iron deficient also.
Yeah.
They may have a concomitant iron deficiency also. So if you correct it, once their anemia gets to some extent corrected, they behave in a normal way. The HbA goes higher.
Thank you.
Now may we request Dr. S. Negi to present a memento to the speaker, Dr. K. Kumar. Now request Dr. A.K. Shetty, ACHD Pediatrics, Central Hospital, Garden Reach, to felicitate the chairpersons. With this, we come to the end of today's academic session.